Assalamu alaikum. Today we will discuss about red eye. What is actually a red eye? Red eye is a condition in which white part of the eye becomes red. There are certain causes of red eye. We will start from the commonest causes and reach up to the least common cause. The commonest causes of red eye are conjunctivitis, inflection, etiology that could be due to bacterial, viral in origin. In bacterial and viral conjunctivitis, the white part of the eye becomes generalized red and associated with discharge. In bacterial conjunctivitis, the discharge may be of yellowish or yellowish greenish in color. In viral conjunctivitis, usually the discharge is like a watery in consistency and watery in color. Then comes to the allergic conjunctivitis. Allergic conjunctivitis can be occur due to exposure of dust, wind, pollen, grass, and the discharge is usually watery in consistency and transparent in color. Now comes to the red eye caused by irritation or inflammation in the lid margin that could be due to blepharitis. That is also a white part of the conjunctiva or white part of the eye becomes inflamed or red in color around the lid margin, more pronounced around the lid margin. Then the other causes are due to keratitis. Keratitis means inflammation or infection of the cornea. In associated with keratitis, the white part of the eye, conjunctiva, in relation to the cornea, close to the cornea, the center part of the eye, that could be red in color. Then comes to the glaucoma. Glaucoma is a condition in which the eye has raised intraocular pressure, and in glaucoma the white part of the conjunctiva in close proximity of the cornea becomes red and the corneal edema accompanied. This is also accompanied by raised intraocular pressure. Another cause is uveitis. In uveitis, that is due to inflammation of the uveal tissue, the redness is also more pronounced in the bulbar part of the conjunctiva, also in close approximation to the corneal margin. Another causes are localized redness could be due to local foreign body or a local trauma by hand or any small object. There is also a localized, all of a sudden redness that could be due to raised intraocular pressure, sneezing, or touching the globe. We call is a subconjunctival hemorrhage. Now we'll come to the treatment of the red eye. The treatment of the red eye depending upon the cause of the red eye. In bacterial or viral conjunctivitis, usually we need an antibiotic or a lubricant eye drops. Sometimes we have to add an steroid to reduce inflammation. In a case of allergic conjunctivitis, usually we need to instill an antihistamine eye drops or a cold compresses. We also need to instill an antibiotic eye drops to avoid additional bacterial infections. If redness or a red eye due to raised intraocular pressure, we need to instill a topical anti-glaucoma drops to reduce the intraocular pressure. In a case of uveitis, we need to instill topical anti-inflammatory drops or a steroid drops or relaxing drops like cycloplegics to get relax the eye. In case of local entrapment of foreign body or trauma to a foreign body, we need to remove a foreign body and also put an antibiotic eye drops or antibiotic eye ointment according to the severity of the trauma. In case of subconjunctival hemorrhage, we usually do not need to instill any eye drop, just to calm down the patient, advise him to refrain from outgoing in the sun or try to relax as much as possible. Thank you very much.